So exposure factors for the extremities, with the exception of the femur. With the exception of the femur is not included in this one. We use, like now, this what I'm telling you now is based on clinical practice. We use between 55 to 65 kVp on 3 to 6 MAS. Yes, 55 to 65 kVp on 3 to 6 MAS. So when you pick a pathology, you know the body parts. Just inside this range of exposure factors, use your head and just pick one. And don't stutter when you say your exposure factor. Don't say 55 kVp, no, 68 k, no. You get, so once you say your exposure factors, you stand by it. Once you have said your exposure factor, you have said it. You get, you stand by it and don't change it for any reason. Just like my okay, this one is not to exposure factor anyway, but like my second viva for 400 level, I made a mistake in OM or facial bones. The angulation is 35 degrees, sorry, 45 degrees. So I mistakenly said 35 degrees. You get? So I had to argue it out with Dr. Abo. You get? How is it 35 degrees? I said it's 35 degrees because I've said it already. So I can't say 45 degrees because that means I'm not sure. So I said 35 degrees and I stood by that 35 degrees till the viva ended. In as much as he said I overangulated my patients and all of that. But then I got what I got. I can't tell you what I got, but I got what I got. Okay? So whenever you say something, don't change it. You get? Just unless maybe your examiner didn't hear you well. Let's say, for example, you maybe in chest X-ray, you said you use 75 kVp on 6 MAS, and your viva lecturer did not hear it. You cannot change it to the correct thing, maybe 10 MAS. You get? So for the extremities, with the exception of the femur, we use what between 55 to 65 kVp on 3 to 6 MAS. So just pick one. You get? Just pick one. Let's say X-ray of the hand. I can use 55 kVp on 5 MAS. I can use 57 kVp on 4 MAS. I can use 58 kVp on 3 MAS. All these exposure factors are correct. You get? Just pick one and say. You get? So which is why there is no good exposure factor. There's no nice exposure factor. I beg, stop that. Pick one that falls in this range and it is what? Correct. Now moving over to the chest, right? The chest and the thigh use the same exposure factor. So whatever you use for the chest, use it for the thigh of that same person. So if I will use 75 kVp on 11 MAS for someone, I'll still use that same thing for the thigh. They have similar thicknesses. Calm down, they can hear me. Use grid or no grid in your examination. So for the extremities, with the exception of the femur, you use no grid. But for the chest and the thigh, it's a gridded examination because the exposure factors are high. You get? Chest and the thigh. Use grid. Sir, I should repeat. I said that you will use grid for chest and thigh because those body parts are thick. So you have higher scatter radiation. So you have to use higher exposure factors, which necessitates the use of grid. Or shoulder. Shoulder is part of extremities now. So you can, from there it is thick and nice. So I can try to use 62 kVp for your shoulder. Works. What have I not mentioned? Okay, FFD. FFD for every other part of the body is 100 centimeters. You get? But in the chest, when the area of interest is to the lungs, you use 150 centimeters. The FFD for every other part of the body, 100 centimeters. When you get to the chest, if the area of interest, you will know your area of interest based on the request form you pick. Master. Pelvis. Pelvis is not in the skin now. I mean, is it there? Okay. So the pelvis is as thick as the chest. The same exposure factors. So you can add pelvis to that exposure factors for femur. The same thing. And it's a graded examination because that body part is thick. FFD. I was talking about FFD. So the FFD, you know the area of interest. Now I'm talking about chest X-ray now. You know the area of interest based on the request form. So if the area of interest is to the lungs, 150 centimeters. If the area of interest is to the heart, 180 centimeters. Don't forget it. 150 centimeters. The heart, 180 centimeters. So if you pick something that has to do with airway, breathing, those are lung, exactly, middle lobe collapse. When you hear lobe, you know it's lobe of the lungs. So you know that this particular examination that has to do with airway, breathing, maybe coughing off of blood, because the blood you are coughing out, that's hemoptysis. The blood you are coughing out is coming from the alveoli of the lungs. So when you pick these things, actually, it is easier to note the one for heart because the heart examinations will carry heart inside the request form or will carry cardiac. Let's say congestive cardiac failure, hypertensive heart disease, hypertension, anything that has to do with the heart. You know the area of interest is your heart, and your FD will have to be what? 180 centimeters. If it is to the lungs, you picked chronic obstructive airway disease, pulmonary disease, and breathing dyspnea, and all whatnot. The area of interest is to the lungs, so you pick your FFD as what? 150 centimeters. Now I will talk about centering points because cardia. All right, so I want to talk about centering points because centering points is one area that I am sure 90% of you don't know how to measure. What's centering point? I don't. I know. I just want to get something. I just want to get something. Don't be centering point to blow.
Finance processes disability. Along the midline of the spinal process of T-cell, which corresponds to the inferior hormones.
Centering point. So just tell me what you are centering point.
I think the spinal process of the seventh vertebra.
I have proven a point now. Okay. Now, centering points. For example, let's position it for just. Now, for example, now let me demonstrate every single thing that was answered here. Now, this thing is not a good exam, right? Good. Now, one person mentioned the inferior border of the scapula. So, I should not center here. That is exactly what you mentioned. Inferior border of the scapula. Another person said mention center. I mean, most of them mentioned center at the seventh spinal cord. So, how do you know? Will you open up this person's body and get the spinal process? Okay. I also heard inferior border of the scapula at the level of the spinal process of 7 to 70 So that is still the same place. Inferior border still at the level of the spinal process of scapula. So when you are finished positioning your patient, right, and you now turn, and you stand somewhere here, I will center at, right? I will center at mid here. You will go there. You know your centering point. You palpate the inferior border of the scapula. This is your centering point. So when you're mentioning your centering point, your hand should be on that point. You have to be pointing at that point because it's a centering point, not right. Good. Now, for large body parts, let me tell you how to get the centering point. Let me tell you how to get the centering points for every part of the body. This is like a technique I use. So most times I don't open clock before Viva. Get because no matter the position, once I know the position, I know the centering points. I don't need to cram that thing. Yes. Oh no. So now when you're positioning this, I'm not supposed to do this now, but let me just do it and go. Like calm down. You learn it. So while you say your centering point, you have to note three things, right? One is that there are two important body planes, all right? There are two important body planes in Viva. The mid sagittal plane and the coronal plane. Now, for PHS test now, I know that the centering point lies along the mid sagittal plane, right? This thing will even help you. Let's say you are positioning for AP both knees in weight area, and you know that the centering point for knee is what? Exactly. But why saying your centering point? You will say I will center. Let's say, for example, if I position it for weight bearing knee now, for weight bearing knee, spread it. If I position it for weight bearing knee now, I can't say I will center 2.5 centimeters away that person because if I mention that, it means that I'll take one from them and can center 2.2. One of them will be for shortened. Get so it is important that you know your body planes because most of these things are not written like this in Viva, so like in Clark. Okay, so you have to know it based on the position the patient is. Come again, just this way. So I know that this centering points. So when you mention your centering points, especially for large body parts, maybe in the extremities it might not work this way because they're not in the body plane. They're not lying. Though they have their own planes, too, but they're not lying in the major planes, right? So you can just say maybe for the forearm, you can say which shaft of the radius and ulnar between the adjacent joints, which is the wrist and elbow joint. But for large body parts, especially here, the torso, right? Because this thing will help you even in your 400 level fiber because you might not be here to say it. Here, you have the spine back because you still do spines, and this spine still fall on body plates. I'm teaching you how to get central points. Now, I'll mention a body plane, right? Where that centering point falls. The next thing that you mention is an anatomical landmark that you can see. In this particular case, it is what? The inferior border of the scapula. We can't see T7. We can't see spinal process of T7 from here. Like how we are looking at this patient, we can't see it. What you can see or what you can imagine is the mid sagittal and where the inferior border of the scapula, which you can actually palpate. Get only then you cannot mention an or a corresponding internal anatomy that you cannot see. So the centering point for chest is now let me employ the use of BCC EF here now so that you see how we use it. So if I walk into the Viva hall, if I position a patient for chest X-ray
I'll perform breathing exercises. Then, so I'll be like, I will expose unarrested inspiration using a collimated horizontal centered along the mid-sagittal plane at a point that coincides with the inferior border of the scapula, which corresponds to what the spinous process of what seventh thoracic vertebrae, using cassette size of 35 by 43 centimeters with exposure factors of 72 kVp on 10 MAS. And since my area of interest is to the lungs, I will use FFD of 150 centimeters. Then for my radiation protection, I told my patient to elevate their chin to keep off radiation to the thyroid gland. I collimated to the area of interest, and I'll now come out and stand on your axe. So you have to just be calm. You have to be calm and coordinated. Don't even fret. So once you have your BCCEF, once you have your BCCEF, you can say all these things in that order. It's good English and you won't forget anything. So that's all on centering points. Now let's say for example, I'll give you another example. Let's say for example now the lumbar vertebrae now, right? AP. Let's say I position for AP lumbar. Imagine this patient is supine, right? Because the examination is not supine. Now, let's say I after positioning the patient for the lumbar history, and then when it's time for me to send my central point, with the use of a collimated vertical beam, I will center along the mid-sagittal plane at a point that coincides with the inferior costal margin. I want to go there and say L3. Don't know where L3 is. Some people walk in and say I'll center at the navel because it is at L3. Who told you? Who told you that everybody's navel is at their L3? So the proper centering point is what? Along the mid-sagittal plane. You see how I'm using this along the mid-sagittal plane at a point that does what? Coincides with what the inferior costal margin. That's centering point for AP lumbar. Now, if I should position this patient now for AP lateral, just imagine this patient in lateral. Look at that like this. Anna, now imagine I position this patient for lumbar, for example. I position this patient, just imagine him lying down, but in lumbar lateral, and I want to mention my centering points. Maybe you have read so much, like your brain feels saturated. Inside clerk, it is written 7.5 centimeters anterior to the spine under examination, which is the lumbar spine, right? So from the lumbar spine, you measure 7.5 centimeters away from it, anterior to it, and center there. Though there is a particular way we measure radiography. According to Elder, two of your hands like this is 2.5 centimeters. So when you take this one, place another two hands side by side to this 5 centimeters and up. So you do that and measure to get 7.5 centimeters. So and you know that there's another centimeter. So many centimeters stroke for black. Yes, centimeters stroke. In the thoracic spine, they say 5 centimeters. But maybe we forgot all these centimeters. See the centering point. I will center along coronal 7.5 centimeters anterior from the spine will fall to the coronal plane. So I'll center along the coronal plane at a point that coincides with what? Inferior costal margin, because I can touch that inferior costal margin. So that's the centering point. So no matter the body parts, once you know where the place, okay, for example now, how would I explain this? Okay, now centering points now, this is just the way they get centering points. Now, for example, now you are positioning for DPO peak. So DP of the hand. There's palmar. What's that? You know that if I should rejoin this patient now for one hand, the centering point is what? The head of the third metacarpal, right? Now let's join one. Let's join another one. What is now the centering point for two hands? The two hands. So maybe you forgot the proximal interphalangeal joints of the thumb. See the head of the third metacarpal. If you should trace this, are you seeing it is still falling in that proximal interphalangeal joints of the thumb, right? So you can say that you center in between the two hands at the level of the head of the third metacarpal. If I should position this patient in ball catcher's position, now watch. The centering point for this now is in between the two hands, still at the level of the head of the third metacarpal, or you can say between what the fifth metacarpal of the joint. Now let's check this out. If you should trace the head of the third metacarpal down to here, the same thing, right? So in case you forget your centering point or maybe you forgot what to cram black, you know the basic centering point for that particular person. Let's say for example, it still happens in the foot. Let's say for example, lateral foot, let's say first planus, you center at the tubercle of the fifth metatarsus. If you are tracing that thing back to the plantar surface for calcaneum, it will center at the plantar surface with 40 degrees cranial angulation at the level of what? 50 tubercle of the tubercle of the fifth metatarsus. This is how you get your centering points. Easy. So if you know the particular body part, you can trace it, round it, and you get the center. Because centering point is just where is the central ray passing through. That's what we're asking. You get. So I think that would be all for me.